thanks for coming today, Meredith. What we'd just like to do is run through what's called the pre-exercise screening tool. It's an industry standard screening tool, so wherever you go for to do any kind of a fitness or an exercise regime, you really they should make you feel the same. So it's not just something we're doing; it's something that everybody has to do. And it's mainly just to make sure that the exercise program and the intensity that we put you on isn't going to be detrimental to your health, or it's going to cause any dramas with you at all. So it'll make more sense as we go through it anyway. So I've already filled out your name and your date of birth. You can actually fill this form out by yourself. Just the game of this, because there's 3 stages, but we'll only do stage 1 and stage 2. We won't do stage 3. But this first one is compulsory anyway. But if there's something you don't want to answer, you can just say you don't want to answer it, and if there's anything you don't understand, you can ask questions.
Okay.
But yeah, this first stage says that the aim is to identify those individuals with a known disease or signs or symptoms of disease who may be at a higher risk of an adverse event during physical activity or exercise. It says this stage you can be self-administered, but we may as well just do it while you're here. Okay. So I'll just read the questions out. These are all yes and no, so they're all pretty straightforward.
Yep.
So it says, has your doctor ever told you that you have a heart condition, or have you ever suffered a stroke?
No.
No. Do you ever experience unexplained pains in your chest at rest or during physical activity or exercise?
No.
Do you feel faint or have spells of dizziness during physical activity exercise that causes you to lose balance?
No.
Have you had an asthma attack requiring immediate medical attention at any time over the last 12 months?
No.
If you have diabetes, type 1 or 2, have you had trouble controlling your blood glucose in the last 3 months?
No.
And do you have any diagnosed muscle, bone or joint problems that you've been told could be made worse by participating in physical activity or exercise?
No.
And do you have any other medical conditions that may make it dangerous for you to participate in exercise?
No.
Okay, that's cool. That's good, because if you answered yes to any of those, we really should be referring you to somebody else before we start. But because you haven't, I might just get you just to sign it down the bottom there, please. Cool, very good. So what we'll do now, I'll leave that one out, is we'll just go on to the second stage. This is just getting a bit more information of your current exercise activity level, and just some medical information as well. I've already done your name, date of birth, I filled in your age, and we know that you're female. Because you're not 55 or over for a female, there's no risk factor there, so there's no dramas. The second question here is there any family history of heart disease, e.g. a stroke or a heart attack? And this is close family, so father, brother, son, mother, sister, daughter.
No.
No? Cool. Do you smoke cigarettes on a daily or weekly basis?
No.
No, not at all?
Not at all.
No. Cool. So this next question is asking your current physical activity or exercise level.
Mm-hmm.
So there's 4 different levels. Sedentary, which means you basically do nothing. And then you've got light, moderate and vigorous. So which one would you classify your normal physical activity as? Light, moderate or vigorous?
Moderate.
Moderate? Yep. And then what we want to have a look at is how many times per week you do that, or how many sessions per week if you're going to a gym or whatever.
Okay. Well, I don't go to the gym, but,
No.
but I exercise at home
Yep.
maybe 5 days a week.
5 days a week? Yep.
On average.
And for how long on an average is each one of those sessions?
It can vary from 40 minutes to an hour and a half, depending on what I'm doing.
So on average we'll just say maybe 60 minutes? Yep. Alright. 60 minutes, so that gives you about 300 a week. So yeah, we're looking for at least 150 per week, so you're way over that. So you actually get -1 risk factor, so that's good. Now we did your height and weight before. and I've written that down so I can work that out. I think we worked out your BMI was 19. Let's just get this wrong.
This is 19 of that.
Yeah, 19.8. So that's way under where it starts to become a risk.
Okay.
So we don't have to worry about that. Now there's a couple of questions here. Have you been told that you have high blood pressure?
No.
No? Cool. Have you been told that you have high cholesterol?
No.
Have you been told that you have high blood sugar?
No.
Alright, so that's pretty good. Just a few more on this page. Have you spent time in a hospital, including day admission, for any medical condition, illness or injury during the last 12 months?
No.
Are you currently taking a prescribed medications for any medical conditions? No. Are you pregnant or given birth in the last 12 months? No. And a bit like we had before, do you have any muscle, bone or joint pain or soreness that is made worse by particular types of activity?
Yes.
Yes?
Yes.
And what are those?
I get pains in my hips when I try and do 4 push-ups.
Pains in hips, yep. Pain in hips. Doing push-ups.
Yeah.
No worries. Okay. Alright. Well, there's no major problems there, is there? What this sort of is trying to work out is what intensity exercise you can do, and we're just looking for these risk factors. So we've worked out that you're at -1, which means you're lower risk. So you can, as it says here, you can participate in aerobic physical activity up to a vigorous or high intensity. And that's why I drag this sheet out, because that is referring to these figures here. So this is your heart rate maximum, which we can work out fairly easily. So you can basically exercise up to more, around about 90% of your heart rate max, which is pretty intense. This one here, this RPE, is just your perceived exertion. So that's how it feels to you. So yeah, we don't have to worry too much about trying to keep it low. You can go pretty much as hard as you want, which is good. And that's it for that one. It's good. Okay.
Thank you.